Hello there, my name's Vicky. I'm one of the GP trainees, so I'm a junior doctor up at Poole Hospital.
Hi, my name's Damien Mayer. I'm one of the surgical registrars at Poole Hospital. I'm one of the junior doctors.
My name's Emily Marshall. I'm a Foundation Year 2 doctor, currently working in psychiatry.
And I'm here in Poole Town Centre speaking to members of the public about the current junior doctors' dispute with the government.
I'm striking over the new contract which is being negotiated currently in its current form, with a number of difficulties and areas of disagreement between the BMA and the government. It's, in my opinion, not safe and not appropriate to be brought into force in its current form.
I'm here today because to show support for all of my colleagues, to show the government that what they're doing isn't fair, and that we feel it's not safe. And unfortunately the only way we feel that we can show this is by going on strike, and it's the most extreme action, and we all hoped it wouldn't come to this, but unfortunately the BMA has decided it has, and we sort of wholeheartedly trust them, so we've gone with what they think, and I think that it's the right thing to do, actually.
Really, we want a contract that's fair for doctors and safe for patients, and the really important thing in this contract is it removes all of the safeguards that prevent doctors from working really long, unsafe hours. The government are trying to remove a big chunk of junior doctors' pay and give us an up to 30% pay cut for the same work or more antisocial hours.
What the new contract wants to do is increase our basic pay but reduce the hours that we're paid for the out-of-hours work. For example, they want Saturday to become a normal working day. They believe that working at 9 PM on a Saturday is equivalent to working at 9 AM on a Tuesday, and I just wholeheartedly disagree. And I feel that it would be unfair for our pay to be reduced for working on Saturdays. Some people under the new contract with their current rotas would get a pay cut, but that's not our problem. Our problem is that we also feel that we'll have to work more hours for less pay.
I don't think this is purely about saving money. I think what they're trying to do is expand a service which is currently working during the week, what we call the elective service. They're conflating that with an emergency service which already operates 24 hours a day, 365 days a year, and they're trying to expand the amount of doctors' hours worked, but for the same pay, so therefore effectively getting more work for the same money.
And we're really worried about how that will affect retention of staff. Already after the first 2 years working in hospital, only about 50% of junior doctors are carrying on with training in the UK, and others are favouring going to Australia or doing more flexible locum jobs. And I think that's really scary, and I think to retain the same kind of service in the NHS, we really need to work carefully with the government to make this sustainable.
The way that we're paid currently is quite complicated. We have a basic pay, which is our annual salary, and then any hours worked above the basics hours, which is 48 hours a week, or if they're antisocial hours, you get a banding supplement on top of that. So this varies depending on what hours you work, how many weekends, how many night shifts. We all work out night shifts and weekends, and our pay reflects that.
Jeremy Hunt has also called into question via various routes our professionalism and our sense of vocation. Personally, I'm working 91 hours this week. I routinely stay late for the care of my patients out of my own choice. This is not an imposed sanction. This is what I do because I believe I give the best care possible to my patients. If my sense of vocation was lacking, I would clock in and clock out at my allocated hours, which I do not do. I said, I don't know a single junior doctor who doesn't work above and beyond every day they work and any time they're required to make sure that care of the patient is not at the forefront of their mind.
And where we wouldn't want truckers or people who work in industries where they can make mistakes and cause harm to people to work long hours, we think the same should be true for doctors who are operating on you and treating patients acutely.
It's about changing our hours, changing safety, in the fact that currently it's legal requirement for our hospitals to monitor how many hours we work and to ensure that we're not working over the allocated hours per week, and the new contract takes away that safeguard, which is concerning for everybody.
The next point that Jeremy Hunt talks about is the increased mortality at weekends, which is factually incorrect. The study he quotes, which has been looked at by 50,000 junior doctors who are trained in analysis of complex statistical papers and also medical statistics, states that less people die at a weekend if they are in hospital. What the stats do show is that there is an increased mortality within a month of patients coming into hospital, which probably reflects that the people that come in at the weekend are only emergency patients. We don't currently do elective work at the weekend routinely. Therefore, the patients who come in at the weekend are the sickest and patients who need the most care, which they get the same care on a Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. The emergency service, especially in my department, is exactly the same 365 days a year. On Christmas Day, you will have the same emergency team as you would have on any Monday or Tuesday the rest of the year. So it is factually incorrect to say that more patients die at the weekend, because the stats don't show that, and it is incorrect to say that doctors opt out of any working hours. We don't.
We need the government to re-enter negotiations and to take into account more things than they are, and for them to drop a lot of the preconditions that they wanted to impose on us. The main reason that the strike happened in the first place is that they said, well, we're not going to negotiate with you, we're just going to impose the contract on you from August. And it had a lot of concerning things in it that we all felt weren't safe or safe for patients or fair to doctors. So that's sort of what led to the strike.
Well, I think obviously it was dismayed by all the junior doctors, being told you're going to have a contract imposed upon you when you're in negotiations, therefore invalidates any negotiation. It's not a negotiation if it's going to be imposed. And at that point, as far as I'm aware, obviously being a non-BMA committee member, I believe that the negotiations were still at a point when people believed there could be some sort of compromise reached. When we were told it was going to be imposed, the general body of opinion was that this is no longer a negotiation, and therefore we're going to have anything, whether it's safe or not, or better for patients or not, imposed upon us, which obviously caused us to have a stronger feeling towards the action we would take against that contract.
A little bit nervous about having it imposed, and originally when we went to ACAS talks, he temporarily suspended the threat of imposition, which was good, but now that's back on the table, and I think what we really want is to have a discussion, and we've been in discussions for 2 years and we just haven't budged anywhere, but we want to restart that and try and find a compromise with Jeremy Hunt that makes sure that we retain a safe, fair NHS into the future.
Nobody likes anything imposed on them, and it's very difficult to. He's not medical. He's not a doctor. He's never worked in the NHS, and I think his ideals are correct. We should have 7-day services, but we actually already do. So he's kind of fighting for something that already exists. So we're just sort of trying to fight back and say this already exists, and the changes you want to make are potentially dangerous for everybody.
Lying would be intentional, and I don't know if he's actually lied or he's unable to differentiate between some of the points he's actually made between the myths and the reality. Jeremy Hunt's had some factually incorrect statements he's made, which are categorically not true.
I think a lot of people will be nervous about that, yes.
I don't know. Obviously, those are the sort of negotiations that carry on behind closed doors. However, there's multiple factors to consider. We know for a fact that privatisation is a part of the NHS currently. You've got about 10% of the budget currently being in private hands, and you've got some of the largest private contracts ever in the NHS being awarded to private firms, such as Virgin taking on community mental health for young people. You've got increasing competition via the Health and Social Care Act, with private companies being allowed to compete on the same footing for NHS contracts, and you've also got things coming in the future such as TTIP, which mean that there's going to probably be more competition around the NHS, some of which may be beneficial, some of which may not. We're only going to be able to see that in the future. Personally, my personal opinion is that privatisation is going to become more common in the NHS, and I believe it's probably going to lead to more fragmented care within the NHS. The first thing he said, which probably was one of the most dismaying to the junior doctor cohort, was about us being able to opt out of weekend working. We do not. Our contracts cover us for 365 days a year. There's not a single junior doctor in the country who has an opt-out clause in their contract. We all work the emergency service. Emergency care in an NHS hospital is every day of the week, every day of the year, and we cover that 24 hours a day. This is not about improving emergency care. We already do that to the best of our ability every hour of every day of the week. So Jeremy Hunt was factually incorrect when he talked about doctors being able to opt out.